Welcome to this webinar, Cultural and Linguistically Appropriate Services CLAS Action Plan for the End-Stage Renal Disease Community. My name is Chow. I'm a social scientist at the End-Stage Renal Disease National Coordinating Center, ESRD NCC. On behalf of ESRD NCC, I would like to welcome you all to this webinar today. Thank you all for joining us. A few housekeeping items. Please add your questions or feedback in the chat box, and we'll get to the questions at the end. All lines have been muted upon entry to minimize background noise. We have exciting content planned for you today. We hope that you can take away the content that will be useful for you and your facility. We have 3 learning objectives for this webinar. The first one is that after attending this webinar, each attendee, we hope that you will gain a solid understanding of the national CLAS standards and their significance to our kidney community. Second, we aim to describe common challenges and barriers to CLAS implementation and to identify strategies to overcome those challenges. And third, we will explore resources and recommendations to enhance the staff training by using real-life case studies to increase organizational, cultural, and linguistic competency. As we move forward, there will be polls that we invite you all to join throughout. Please remember that there's no right or wrong answers to any of the polls. This is helpful for all of us to know where we think we are at. We also invite you to add any questions or comments you have in the chat. Please note that the chat function is set to have 2 options. One option is that you can send a message to everyone, and everyone here will be able to see what you put in the chat. Another option is to send your message only to our panelists. You can choose whichever you like. And now I will turn this over to Lee, our public health specialist from the ESRD NCC Health Equity Team, to provide us with a brief overview of the class.
There we go. Thank you so much, Chow. All right, we're going to start off with a poll. So on the right side of your screen, there should be a question asking, how familiar are you with the CLAS standards? While you all answer that, let's start out by discussing what CLAS standards are and their purpose. The 15 national CLAS standards can be viewed as one principal standard which serves as the overarching guide, and then 3 accompanying themes. You can see them illustrated in the diagram towards the right side of this slide. At the top of the diagram, you'll see the principal standard. The principal standard is to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. The first theme is governance, leadership, and workforce, which consists of 3 CLAS standards. The second theme is communication and language assistance, which consists of 4 CLAS standards. And last but not least, the third theme is engagement, continuous improvement, and accountability, which consists of 7 CLAS standards. The principal standard and the 3 themes combined make up the 15 national CLAS standards. And these national CLAS standards play a crucial role in healthcare settings to advance health equity, improve quality, and eliminate health disparities. CLAS standards are a comprehensive set of guidelines that address cultural and linguistic differences to enhance population health. By adopting CLAS, you as healthcare providers can ensure that services you provide are understandable, effective, and equitable by considering the population you're serving, the patient population's cultural health beliefs, health literacy levels, communication needs, and cultural health practices. We're all working towards ensuring equitable access to healthcare for individuals, and CLAS is essential to this and to improving healthcare outcomes, particularly for groups that have been economically and socially marginalized. Okay, now let's take a quick look at the poll results. It looks like a majority of you are somewhat familiar with the CLAS standard, so the action plan should serve as a really great aid to help expand upon your existing knowledge. And for those who may not be familiar at all with the CLAS standards, the CLAS action plan has a ton of really great background information about CLAS to help you become more familiar. Okay. And on the right side, you should see another poll question pop up asking, how familiar are you with the new health equity attestation measure? While everyone answers that, I'm going to briefly highlight how health equity, CLAS, and the new attestation measure fit together. So CMS defines health equity as the attainment of the highest level of health for all people, where everyone has a fair and just opportunity to attain their optimal health, regardless of race, ethnicity, disability, sexual orientation, gender identity, socioeconomic status, geography, preferred language, or any other factor that affects access to care and health outcomes. The national CLAS standards can serve as a resource to help you to incorporate health equity into your workflow. And the new ESRD Quality Incentive Program, or ESRD QUIP attestation measure, is aimed to assess dialysis facilities' commitments to health equity in 5 domains. The 5 domains are equity as a strategic priority, data collection, data analysis, quality improvement, and leadership engagement. You can use the CLAS action plan to address each of the 5 domains specified in the health equity attestation measure. We won't be going into details regarding the ESRD QUIP measure today, so we want to encourage you all to reach out to your networks as well to find out what tools are available to help you meet each domain in the measure. And let's take a quick look at the poll again. It looks like there's a mix kind of. Maybe we're not so familiar with the attestation measure yet, which is totally fine. Your network is a really great tool to use to become more familiar, and keep an eye out during the summer for more resources about the attestation measure from NCC as well. Now, moving into the action plan. One reason why we created the action plan specifically for the kidney community is because CLAS standards provide valuable strategies to help promote person-centered care by addressing common issues in the kidney community and providing strategies to overcome them. For example, racial and ethnic health disparities are well documented within the ESRD community. Kidney disease affects minoritized populations disproportionately compared to their white counterparts. Black and Hispanic Americans are respectively at a 4 and 1.3 times greater risk of having kidney failure. As you can see on the graph on this slide, the prevalence of ESRD is much higher in people identified as Black or African American compared to all other races and ethnicities. To address these disparities, CLAS standards offer a framework to help tailor services to meet the needs of all populations. CLAS does this through improving healthcare access by enhancing patient-provider communication, ultimately promoting culturally competent care. By adopting CLAS, you can ensure that individuals from diverse backgrounds receive equitable care and that patients you are serving understand and can use the information you provide. By tailoring to individuals' cultural and linguistic backgrounds, as well as their cultural beliefs, we can have effective communication with the people we serve, better health outcomes for our communities, and ensure patient safety. Now, we again invite you to participate in our third polling question, which should pop up on the right side of your screen, and it asks, have you received any training on implementing CLAS standards? While I give you guys a chance to answer that, I'm going to cover a few more reasons why CLAS is important to the ESRD community and kind of answer the question, why CLAS and why now? One of those reasons being the language barriers and health literacy disparities that exist within our ESRD population. Research indicates that there are a large proportion of patients on dialysis with limited health literacy. Limited health literacy is associated with poor health outcomes such as increased hospitalizations and emergency department use, cardiovascular events, missed dialysis, and faster disease progression. Many patients with ESRD also come from linguistic minority backgrounds, which can cause communication barriers. Interpreters and other language services are available at no cost to the patient. However, dialysis facilities need to work to prioritize language access and make sure that patients are aware of that resource. CLAS standards also serve as an aid to culturally tailor health education, promotion, and prevention strategies to fit patient needs. For example, asking questions like, what food does your patient population gravitate towards? How can you tailor nutritional education based on cultural food preferences and help make kidney-friendly meals more accessible? Maybe a patient learns best through pictures, or maybe a patient learns best through hands-on demonstration. By applying the CLAS standards, you can integrate all of those considerations into your workflow. Okay, and let's take a quick look at the poll results. It seems like many of you may not have received training around CLAS implementation, which will make this action plan a really useful tool. The action plan does provide a breakdown of each of the 15 CLAS standards and has strategies and resources to help you with the implementation. Now, some of you might be thinking, but how? How are we going to do this? Or maybe you're thinking about some of the difficulties of applying CLAS standards or how to even begin to introduce CLAS at your facility. We understand that there are some potential barriers that exist when implementing CLAS, and we've seen many of these barriers being reported previously. This action plan has strategies and resources to help mitigate some of the associated challenges. For example, you may encounter resistance within your organization. Organizations may interpret CLAS as another competing priority. However, you're likely meeting many of the CLAS standards already. And strategies such as creating awareness around the CLAS standards and ensuring diverse leadership can help reduce resistance. Additionally, revisiting your mission, vision, and goal statements and ensuring that equitable care and high-quality care are embedded within those statements can reduce organizational resistance to CLAS standards, and studies have shown that CLAS also helps improve patient safety and health outcomes. Another barrier might be training availability. It's important to follow the CLAS strategies to understand your facility's training needs and work to embed the needed training and education into your workflow. There are some training resources available in the CLAS action plan in a variety of different formats to help meet your needs, including some that are just 5-minute videos. Your network also may have additional resources for you, and if your facility is part of a larger dialysis organization, there might be additional resources available through them. The key here is that these trainings don't have to be done all at once. You can select one that meets your facility's needs and move from there. Another barrier related to implementation might be costs. However, using the free resources provided in the action plan or through your network or through your large dialysis organization can help to reduce costs. Studies have also shown that CLAS is cost effective, and it's important to note that CLAS helps to reduce adverse patient outcomes and errors, which can improve the quality of care at your facility and better health outcomes for our patients, which is the goal that we strive for. Now, the action plan is available on the ESRD National Coordinating Center, or NCC's webpage, and we'll also put the link in the chat at the end of this webinar for you all to be able to download the document. To wrap up, I'd also like to just provide a brief overview of what content looks like inside the action plan. I'm going to cover general strategies in the action plan that work to address patient needs. For each of the 15 CLAS standards in the action plan, you'll see a table of strategies accompanied by action steps and resources. By using the strategies, action steps, and resources, you'll be able to meet the associated CLAS standard. And on this slide, we have some examples of some of those patient needs and some of the strategies in the action plan to help meet the patient needs. So, for example, patients with limited health literacy. It's crucial to find out the patient's learning style and use questions like, how do you learn best? Someone might prefer auditory learning, but someone else might prefer visual learning. Other strategies, such as communicating using plain, non-medical language and using shorter sentences, can also help facilitate understanding and can help meet the needs of patients with limited health literacy. Assessing your patient's understanding can also mean using open-ended statements, such as, tell me how you take your medications. Another example of a strategy of meeting patients' needs, specifically for culturally diverse patient populations, is having cultural competency training for staff. This is essential for raising awareness and promoting sensitivity around cultural health beliefs and practices. Additionally, creating customized treatment plans that are culturally centered can improve patient outcomes. Engaging staff in regular dialogue, such as during team huddles, about meeting the needs of diverse patient populations can further reinforce a culture of inclusivity at your facility. One more strategy that we'd like to highlight is for people with limited English proficiency. Using I Speak cards and other resources to help identify patients' native languages and then providing the appropriate language assistance through translation resources like bilingual staff or phone or video interpreters are key to communicating with patients who have limited English proficiency. Communicating with the patient in their native language can help to ensure equitable access to healthcare services. And thank you all so much for listening to this overview of the CLAS action plan. I would like to turn it back to Chow now.
And before we welcome our panelists, I wanted to also emphasize that we wanted to focus on that when we talk about implementing CLAS standards, we want to emphasize that take one step at a time. You don't have to do it all at once. As a quote from Martin Luther King said that you don't have to see the whole staircase, just take the first step. And now I wanted to welcome our panelists to walk us through roadmaps and case study to show how we could use these during team huddles or meetings to engage in conversations to promote culturally and linguistically appropriate services. I am pleased to introduce our three panelists today. We have Claire, Quality Improvement Coordinator at Midwest Kidney Network, ESRD Network 11. We also have Lucille, Patient Service Manager at Health Services Advisory Group, ESRD Network 13, and Audrey from QSource, the Executive Director from ESRD Network 10. We would like to invite Claire, Lucille, and Audrey to help us explore how these scenarios can help us better understand how to apply CLAS standards in clinical practice. Throughout the three scenarios that we will be presenting and walk through today, we'll have moments of what could be done differently. And please take time to also consider what your responses are, how you could use these scenarios to dive into deeper discussion with your team. We'll also welcome you to add your reflections and responses to the chat as we go through the roadmaps and case studies. So for our first roadmap, I'll be teaming up with Claire to walk us through this scenario. Claire will share some details about the case, and I will step into the role as a staff member at the facility who will answer the questions Claire raises. Claire, thank you so much for being here with us. Could you please tell us about what this scenario is about?
Yes, thank you, Chow, and thank you everyone for joining us today as we walk through these scenarios to get you more familiar with how to bring CLAS into your facilities. So this first scenario that we're going to look at today involves transportation. And as we all know, that's an area of patient care frequently wrought with many challenges. So here we're going to see an example of why we need CLAS and how it can greatly impact patient safety. And like the other roadmap scenarios we'll go through in our presentation today, think about how these challenges don't just exist alone in a vacuum. Rather, by doing a deep dive through these challenging scenarios and looking at the root causes each step of the way, we can look at the impact of communication and how CLAS considerations come through in each decision point. So in this case, a non-Hispanic Asian female patient who uses a wheelchair and has limited English proficiency has been waiting alone in the facility after her dialysis treatment, in the waiting room after her evening treatment at the end of the day. When the correct transportation company for her arrives to pick her up to bring her back home, it was discovered that she was no longer in the facility waiting room. So before going further into the rest of the scenario, this would be the point where we would pause and reflect. And if you were using this in a team huddle, some questions you could run on to ask your team members would be what strategies could have helped to ensure patient safety for patients who use transportation services? What does it mean that every staff has ownership for patients' quality of care? And what are some strategies our facility could use to help patients with transportation needs to ensure their safety? So I'm going to ask Chow to provide some feedback now.
So I wanted to maybe have us consider, is it possible that someone from our staff could let the transportation company know ahead of time, that maybe letting the transportation company know that we have a patient who doesn't understand English very well, and could you have the driver to verify the patient's information before the patients even get onto the van? Or maybe another things that we can consider is that can we have one of our dialysis staff member to help make sure that the patient has an identification card stating the patient's name and the destinations, and when the driver comes, that the driver can use that to the card that the patient has to verify that. So some possible solutions and ideas for this scenario.
Thanks, Chow, for the brainstorming. And so, yes, using a name tag or an identity card is a great idea to improve patient transportation safety. Another key point is having regular communication with the transportation companies that the dialysis facility utilizes. This could help ensure that drivers are updated, especially as there are new drivers, that they're familiar with the needs of the patients, particularly those unique needs, including communication and language needs. So we're going to look at what happens next as this scenario progresses. So thinking about the previous step, the patient's driver had arrived and the patient was gone. And at that time in the clinic, no further action was taken. The patient's caregiver was not notified when the patient was missing with unknown whereabouts for about 2 hours. And later that evening, the patient then was returned to the facility after she was taken to the wrong destination by the wrong driver, unfortunately. And so now pausing again here of looking at what are some questions we could raise at a team huddle to prevent a situation like this from occurring. And then, Chow, if you could provide some feedback.
Thank you, Claire, for walking us through that. And of course, we wanted to be able to prevent stressful situations like this. But in the event that it occurs, we want to make sure that we have best possible communication channels for this. And I wonder if it will mean that we wanted to review our communication rules and policy with the family and the care partners during a situation like this. Who will be initiating this contact and when? And how do we keep the families or care partners updated about the status of the patient's whereabouts in an event like this? And I wonder if this is also a good time that we can also discuss how can we as a team to ensure that the families and care partners are informed about patient safety event, and is there anything that we could do differently at our facility in order to ensure that we have a culture of transparency and accountability in the event like this?
Thanks, Chow. And just by utilizing scenarios like this in a huddle with the team helps to foster that culture of transparency and accountability. To continue, it's essential to have a clear plan of communication with patients and their care partners when there is an event around patient safety. And just as important is training and staff education and having a plan in place so that staff understand transportation policies within the clinic and how to meet the needs of patients with limited English proficiency or other communication needs. Think of a person who is hard of hearing or has low vision or someone with maybe some cognitive disabilities. And this training should occur regularly. So not just upon hire and orientation, but returning to that and refreshing staff on what the plan is. Also importantly, we talked about is routinely reviewing transportation service policies to ensure accountability. So now thinking about what modes of communication with transportation companies and drivers are available and effective. How could we ensure drivers understand patient needs? And how might this process be sustainable? So not just a short-term fix, but continues to work for the long run.
So I'm thinking about the multiple contact points that we have. Initially, we usually have our social worker screen for any transportation needs upon intake, and the social worker or the AA will set up a standing order for the patients. And I wondered, how can we check for our regular communication with the transportation company? Is it that maybe our AA could help identify any other needs after we have established the standing order for the patient, whether it is for a person with limited English proficiency or like Claria mentioned that maybe it's a person with low visions, and then maybe it's our AA will notify the transportation company of these needs. And I also think that for the contact point that we maintained with the transportation company, I think we need to our entire team to ensure the patient safety.
Thanks, Chow. I again like how you talked about the entire team, and it shows how, in huddles and in brainstorming with the staff, we can maybe identify opportunities we haven't thought of before to make sure that our policies are maintained and up to date, and most importantly, meeting the needs of our patients. Meeting patients' health-related social needs also means that CLAS standards are considered and incorporated into the plan, the resources, and the services provided.
Thank you, Claire, for walking us through these roadmaps and raising those very important discussion questions, which we hope that it will be used on similar questions like this in the team huddles. And this is one of the 4 roadmaps that are included in the CLAS action plan for the Kidney communities. And the goal is for you to take this discussion material at your team huddles and to identify how could your facility prevent similar situation like this, or how could this scenario prompt your facility and your team to review your current process and policy to ensure patient safety. And these roadmaps and case studies aim to prompt you and your team to look at areas where there might be some action steps needed to make sure services are meeting the CLAS standards. And for now, we're gonna take a look at our next roadmap, which is another roadmap inside the CLAS action plans. I'll be teaming up with Lucia on this one. And Lucia, can you tell us what this roadmap is about?
Thank you, Chow. This roadmap will showcase the need to foster inclusivity at the facility to promote person-centered care. A non-Hispanic African-American female in her 30s urgently needed to use the bathroom and was denied access to the unoccupied staff restroom. The patient had previously seen other patients use a staff restroom in the past and felt discriminated against because she was denied use of the bathroom. The patient had an embarrassing bathroom incident because she was not allowed to use the bathroom when she urgently needed to. Some questions we can review to better understand how the patient felt in this situation are: how might the experience of being denied access to the restroom be interpreted or perceived by an individual as discriminatory? How might this incident be oppressive?
Thank you, Lucia, for the questions. And as I think the first response is that restroom access is a basic human need, and being denied access can make any person feel helpless, desperate, or even dehumanized. And in this scenario, our person may feel discriminated against because she was denied access while seeing other patients were allowed to use the staff restroom previously, suggesting an unequal treatment, and the situation can be perceived by the person as oppressive, unfortunately.
Yes. Given the historical context of certain populations being denied access to places and resources, this incident can be seen as oppressive in several ways. It may evoke painful reminders of past injustices, and if the denial of restroom access was based on the individual's physical characteristics, it could indicate that the person experienced bias in this setting.
So what happened next after the person being denied access to use of the staff bathroom?
After investigating the incident, the facility found that staff did not consistently follow internal policies about staff restricted areas. Unfortunately, the patient decided to transfer to another facility after the incident. What we should consider is, what are some strategies to explain facility operations to help patients understand the safety protocols and policies in place? For example, the reasons behind schedule constraints or limited access to certain areas.
And I wonder, could it be that maybe there are trainings that will be helpful that are on cultural sensitivity and implicit bias? Or is it a lack of communication with the patients that led to a misunderstanding between the patient and the team? Is this a topic that we can discuss further as a team? How can we address the patient's concerns and improving the patient's understanding of the facility safety protocols. And maybe additional training or discussions or review the guidelines could help the staff prioritize the patient's need during the emergency, such as in this instance, if it's appropriate, as temporary allowing the patient access to the staff restroom and make sure that maybe there's a staff nearby to prevent any accident.
That would definitely be one possible solution, but also having a process or system in place to ensure patients' concerns are addressed immediately in a culturally sensitive way is essential. The incident raises important questions about power dynamics in healthcare, such as how does power influence patient care? What roles does power play in addressing patient concerns? How can healthcare organizations foster a culture of accountability and responsiveness to patient concerns, thereby mitigating the negative effects of power imbalances?
And I think, as Lucille, you mentioned about the power imbalances, staff sharing information with the patients about certain area are restricted for a safety reason to avoid any misunderstanding, and staff not withholding information will help make sure that the patient is not left without information or left feeling powerless. It is also, I think, important for us to consider that the patient need to understand why there are specific rules or policy exist for their own safety, for the safety of the patients, and explaining the safety implications of specific rules using plain language, non-medical jargons, and help patients better understand why policy exists. And of course, and we should always focus on providing the person center and the whole person care by offering support to the patients in times of need. And in this case, I think it could be that do we need to examine whether that a staff accompany the patient to the staff restroom would be an appropriate action to take.
Yes, absolutely. And also staff needs to consistently follow policies so patients don't feel marginalized when policy intended for patient safety is enforced.
Thank you so much, Lucille, for walking us through this roadmap, and this also highlight the importance of how might we better communicate our intent and motives. How might we enhance culturally and linguistically appropriate services and building and maintaining a trusting relationship with our patients? And for our next case study that we'll be looking into, I'll be teaming up with Audrey for this. Audrey, can you tell us what this case study is about?
Sure, thanks, Chow. This case study is for addressing facility level barriers to care, and the situation is a Hispanic male in his 30s found himself without dialysis care when staff requested that he not return to their clinic as a transient patient. While he was there, staff had concerns about the patient playing music and talking loudly. They had perceived the patient as aggressive because he was making finger pointing gestures at staff members. And then the case had intensified and ended when staff called police to remove the patient. The patient felt that his native Spanish dialect had played a role in his removal and subsequent ban from the facility as a transient patient. So Chow, what are some of the key challenges that you see in this situation?
I think in this situation, it's unfortunate, and maybe it is possible that the staff may not have been aware of the communication challenges. If the staff did not communicate with the patients prior to the patient's arrival, or maybe the staff has not made contact to the patient's home facility before the patient arriving at the facility. And without the proper communications or the prior knowledge of the patient's preferred languages, the staff could maybe need to do a quick language assessment upon the patient's arrival, which may not have happened. And I wonder if a challenge from the staff of not using any tools or not having any tools at their disposal, such as AI speak car, and the challenges to better communicate the facility's rules and policies with the patients at the time.
Yes, staff should be properly trained to intake transient patients and prepare for needs beforehand. And cultural competency training is one way to help staff work with patients of different cultural and linguistic backgrounds. It can also lead to improved patient communication, patient safety, fewer healthcare disparities, and decreased costs for the facility. So it's also a good business practice. What kind of resolution do you think could have occurred in this situation?
And I think if the staff, once they realized that the patient was not listening or not responding to the staff about the facility's policy, then maybe the staff, one possible resolution is that the staff could have immediately assessed whether the patient actually understands. And rather than assuming that the patient does not want to respect the facility's policy, and maybe the staff will be able to find out the need for an interpreter services to communicate with the patients before removing the patient from the facility. Would that be a possibility? Or maybe the staff could meet as a team and discuss how to better communicate with the patients. Maybe that's another possibility.
I agree. Those resolution ideas actually do align with the CLAS standard of governance, leadership, and workforce to recruit, promote, and support a culturally and linguistically diverse governance, leadership, and workforce who are responsive to the population in the service area. And then also to educate and train that governance, leadership, and workforce in CLAS policies and practices on an ongoing basis. So all those strategies can help improve the facility's training structures and transient patient care in the future. And then additionally, just as simple as discussing things as a team might have helped improve the staff members' understanding of the situation before further conflict occurred.
And I wonder, maybe are there any ways that the team can look at the policy of how and who is responsible for reviewing transient patient medical records before the patient's arrival, or is it the demographics, the preferred languages, and if needed, who is responsible for getting any additional information by contacting the patient's home facility?
Yes, I think that all of those practices would support the CLAS standards, and if those have been followed, there perhaps could have been a better outcome with this specific case.
Thank you, Audrey, so much for walking us through this case study. And then I think this case also highlights the importance of cultural sensitivity and effective communication in healthcare settings. And as we have looked at 3 different scenarios, now I wanted to remind you all that we do have the 4 roadmaps and 4 case studies inside the CLAS action plan. And the intention for you all is to take these roadmaps and case study one at a time. You can share at your team huddle and use the discussion questions accompanying those roadmaps and case study so that you can consider how similar situations may have occurred in the past and how can we work as a team to prevent similar situations from happening in the future. And please feel free to share any questions or comments you have in the chat. And if we don't get to all the questions, we'll definitely follow up as well. And as we wait for some of the questions to come in, that I would like to start posing some questions to our panelists. So a question I want to have for Claire is that what are some of the strategies that you can share with us? How can we involve the entire team to effectively meeting the patient transportation need, especially when there are different communication needs, such as the one that been mentioned, limited English proficiency, or if the person is hard of hearing, and how can we address the issues with diverse linguistic needs, and that will need some tailored efforts, and what are some steps that, Claire, you can share with us so that we can make sure that in the event like the transportation information service can meeting the CLAS standards and improve patient safety.
Thank you, Chow. I'll try to break down each of the different pieces of the question. So we touched a little bit on it earlier, but an important first step is ensuring, again, that every team member feels empowered in their role for patient safety. And what we've tried to do today too is demonstrate how, breaking down different challenges or scenarios as a team and stopping with pause for reflection and giving opportunity for people to, voice, what were those underlying causes and give some creative solutions can help fostering that the entire team feels effective in meeting the patient's needs. And then specifically for transportation, as was this scenario, there are team members that are going to have specific roles, just to get things done. Like we talked about having, a role for the AA if it's to call and ensure the transportation is on their way, or the social worker for screening for the needs. But again, just ensuring that because people have specific roles doesn't mean that all the team members don't have a role in speaking up and offering to identify solutions through team huddles. Another way can be to review the policy together, looking at how we're ensuring patients with limited English proficiency and patients with other unique needs that we talked about could receive assistance from a staff member with transportation. So in addition to the communication card we talked about, or an ID card, maybe there's a clinic policy or routine that needs to occur when a patient leaves to ensure their safety, whether it's the transportation company checking in with an AA or another staff member before leaving with a patient who's unable to communicate their needs. And then a final potential solution is once transportation is arranged for a patient, particularly if it's new patient or a change in transportation, having some sort of routine to check in with the patient, the care partner, or if it's a care facility the patient is returning to assess for any areas of concern, and then perhaps routinely convening meetings with transportation providers as well. I know one facility in our network had identified that they quarterly meet with their county transportation, who provides most of their transportation at their facility, just to identify how things are going, and then again, see if there's challenges or needs for patients that aren't being met or could be improved upon during the transportation.
Thank you so much, Claire, for some great suggestions and action steps. And I wanted to also ask Lucille, our panelist, and how might the roadmap that we saw in the bathroom incident be used in a similar situations, and what could be and what will be some similar situation in a dialysis facility that we can use this roadmap to illustrate the need for enhancing person-centered care.
So, Chow, I think that this situation can be used as, these situations can be used as a roadmap, as a guideline for any situation that involves patients and issues that have to do with communication and power dynamics. It can be used in situations where there's a breakdown in communication and where there are issues with implementing policies. Some examples could be sharing information with patients regarding transplant and home dialysis with some patients and not with others, perhaps due to bias, and use of other facility properties such as the phone or the fax.
Thank you so much, Lucille, for adding those. How might we apply the the case study, the roadmap, into another one. And I wanted to also ask Audrey, and before we open up for also other questions from the audience, that how might our own perceptions about what appropriate clinical environment is affected on this scenario? What kind of strategies or trainings do you think can help staff explore their thoughts and feelings and how certain patient behavior might be deemed acceptable or not?
The perceptions of the facility could be a case of implicit bias, which refers to attitudes and stereotypes that affect our actions and decisions in an unconscious manner. So when trying to combat implicit bias, there's two important first steps that are to recognize that we all have implicit bias, and it can negatively affect clinical interactions and outcomes. And then to accept the responsibility to identify and understand your own individual implicit bias. So there's several strategies for overcoming implicit bias. Some of those are stereotype replacement. So becoming aware of the stereotypes that you hold and then creating non-stereotypical alternatives to those. Counter stereotypic imaging. So remembering or imagining someone from a stereotyped group who does not fit that stereotype. Perspective taking, imagining the perspective of someone from a group different than your own. More simply put, to put yourself in the other person's shoes. And then emotional regulation and mindfulness are also good for combating implicit bias. There's a lot more information on implicit bias out there. A lot of the ESRD networks have CLAS materials that will kind of outline some steps for combating this.
Thank you. That's so helpful to learn about that and to further look into those information resources. And I wanted to also pose a question to the entire audience is that please share your responses in the chat if you would like to. How can we look beyond the content and see the context for all these roadmaps and the case study that we look at? And any other thoughts that you wanted to add is that what are some similar situations that you can apply what you saw today from this roadmaps and the case study to improve patient care at your facility? And I also wanted to ask Lee to help read any questions and or responses from the chat if relevant, and then to share those with us all.
Sure. So I did see one question in the chat. It says, most of our education materials are based off of written information, which we go over with patients verbally. If a patient identifies that they learn best by doing, do you have any advice or ideas on how to meet that need? And Chow, I can start this question, and then if you want to add anything. So I think learning by doing, it would be great to emphasize any practice, rehearsal, or role playing you can incorporate to give the patient an opportunity to become accustomed with whatever you're trying to teach them. For example, if you're trying to teach a patient about kidney-friendly nutrition, I think giving them the opportunity to try to find a kidney-friendly recipe or use an online food analyzer and then check up with them and see how that process went and make sure they're comfortable with it. Giving them that real opportunity to rehearse how they would be able to use those resources outside of the facility would be a great way to kind of focus on learning by doing. And Chow, I'm not sure if you have anything to add.
Yeah, I think that's a great example. And also we've heard that if it's in a situation like the dietary guidelines and talking through about fluid intake, some dietitian actually say that they have just the cup and the size and everything in front of the patients. So there's not only visual cue, but also that hands-on demonstration, like which one would they choose and things to demonstrate and right in front of them. So putting those real life items in front of the patient may also help that demonstration and a part of taking information. And I wanted to see if there are any other questions from the audiences and about anything we discussed, comments?
I do see one more question in the Q&A box. It says, transportation happens outside of normal business hours. Often there is no administrative assistance working at those times. How is a transportation company not making sure that they were taking the wrong patient or a patient not being allowed to use the staff restrooms? How would those be examples of implicit bias or microaggressions? And Chow, Claire, or Lucille, do you have any insight on this question?
I think those are great questions. And I think one of the questions about the clinic facility hours, I think that might be a good time to come back as a team and huddles as to who will be the point person to contact, I think, at the time to contact the transportation company, because there might not be an aide, and I recognize that will be the situation, is that contacting the transportation companies that how can the manager from the transportation company make sure that they have the enough and sufficient staff training that their staff and their drivers will actually do that consistently, and not just one time and checking, but do it consistently, because there are going to be events where the AA may not be present at the time of the facility. And I think that's a great time for brainstorming too, because I think one size does not fit all, and I think that might be a unique situation that we need to tailor for the local context too. And I don't know if Claire, you wanted to jump in, or Audrey or Lucia wanted to add anything on that.
Yeah, thank you, Chow. I think, yes, it again speaks to the need to have that good working relationship ahead of time and ensure that the dialysis facility and transportation company are convening regularly to make sure that those issues are discussed ahead of time, that these are the hours for the facility. And so how will needs be handled after hours. And as far as I just wanted to briefly touch on the staff restroom piece of it, because I know that this is something that happens frequently in units, and it might not be that it's the staff having a microaggression or implicit bias, but the perception of the patient is that if the policy isn't being followed consistently and some staff let some patients use the restroom, but then this patient asks and it's a staff member that's following the policy, that's perceived as it's okay for other patients to use the restroom, but not okay for me. And then when you look at the historical context, that is when it can advance into a situation where the patient is choosing to transfer because they feel that they are being discriminated against. And I would, then defer to Lucille or Audrey for any further input.
Thank you, Claire. Well said.
Thank you for adding that comments. I don't know if Audrey, you have any other input that you wanted to add for any of the questions being raised?
No further comment. Thank you.
Thank you. And I also wanted to see, I see that there's a response and comment in the chat is that from Susan saying that training on implicit bias and making sure that the grievances are culturally sensitive. And that's also one of the meeting one of the CLAS standards to making sure that the grievances are also culturally sensitive, that patients have a way to do. And in this instance, relevant to the bathroom incident is that understanding the power that we have as dialysis staff is also important, that we do not overpower others. And thank you, Susan, for the comment and the feedback on that. And also definitely DJ, thank you for adding that as a communication. I think throughout the three scenarios, either from the transportation, from the bathroom incident, or the one with the transient patient, is that the communication is key. That is not only communication with the patients and the patient with the team, but also with other stakeholders like the transportation company, and or in the instance with the transient patient, that communication with the patient's home facility. So thank you for raising that we need to enhance our communications, and huddles can be beneficial to continue to have discussions and issues. And thank you, Colleen, for the feedback too. So thank you all for the feedback, and please feel free to share more if you have any other feedback. And I do wanted to acknowledge our the class action plan is I want to thank everyone for engaging our discussion, but I also want to acknowledge our class strategic workgroup members. And so much gratitude for our class workgroup members, and many of them are also on the webinar today. As a class strategic work group, we identify these strategies through research and discussions, and that also shows that one of the steps that we encourage all the staff to do is to reach out to your network to collaborate on meeting the class standards. And while we wait for any last questions that we have, before we close out our webinar, we want to ask that you all please download the class implementation action plan. We'll put the link in our chat, and also put the link in the follow-up emails. And while you download the class action plan, we also really want to encourage you to reach out to your ESRD network to integrate class standards into your daily practices. As you saw that many of your ESRD network staff, they've been involved in the development of the class action plan, then they have been the experts on some of the things that we discussed today too. So please do reach out to your ESRD network. And I wanted to thank you all for attending this webinar. And also please do fill out our brief post-webinar survey. And one thing we wanted to emphasize again is that just take one action step at a time. And many of the 15 class standards you are already working on, and you are already meeting some of the class standards. So we wanted to emphasize that as you as the main takeaway as you download the action plan and then reach out to your ESRD network. And we want to thank you all for you do to advance health equity in the kidney community. So thank you all for being here today, and we're gonna stay on a few minutes. If you have any last minute question, you can send it to us, to our panelists. But thank you all for being here, and we look forward to hearing from you in the near future.